Breast and cervical cancer have very few warning signs, which is why it's so important to be screened early. And that's why services offered by the West Virginia Breast and Cervical Cancer Screening Program can be lifesavers. Joining me to talk about that is GeorgeAnn Grubb, the program's director, as well as the director of the Wise Woman program. Thank you, GeorgeAnn. Glad you're here today.
It's good to be here. Thank you.
Can you tell us a little bit about what is the program that we've just talked about? What is the West Virginia Breast and Cervical Cancer Screening Program?
That's a mouthful, isn't it?
It is.
The Breast and Cervical Cancer Screening Program has been available to West Virginia women for 25 years now. We were started in 1991 by the Centers for Disease Control and Prevention, otherwise known as CDC. And we've been providing women's health services throughout the whole state for that long. We have over 300 providers in the state, clinics, health departments, free clinics, that sort of thing. And we offer coverage, financial coverage for clinical breast exams, pelvic exams, Pap tests, as you mentioned earlier, and mammograms for women who have no insurance or they're underinsured, and we'll talk about that later. Women who are between the ages of 25 and 64. They're West Virginia residents, and they qualify for they're considered low income, but our guidelines are very generous. It's 250% of poverty.
And I think it's great that we have been doing this program for 21 years, and we obviously want to keep the word out there that we're here and we're available to help women because, as we talked about in an earlier segment, we still have relatively low screening rates for women for the type of things that could be, in essence, either early detection or even preventable if we find out early enough. So it's good that we're having this conversation. We also have a program called Wise Woman. Can you tell us a little bit about that program?
Sure. Wise Woman is also funded by CDC, and it addresses heart disease, risk factors, all those that you talked about earlier. We're a sister program with the Wise Woman program, and so women in West Virginia can also get screened for heart disease. When they come in for their annual Well Woman visit, get their breast and cervical screening, they may also be eligible to sign up for the Wise Woman program and get cardiovascular screening. But Wise Woman also does a lot of lifestyle programs, health coaching, helping women make those choices that you talked about earlier that are often difficult to make about just changing your diet, adding in physical activity, quitting smoking. And there are resources to help with all of those.
Now, I understand that you have a personal connection to this and that you're willing to share your story with our viewers. So if you don't mind, could you tell us a little bit about how you have been connected to the program in the past?
I'd be happy to. It was around 1991, 92 when the program was just started in West Virginia, and I had just moved back to my home state from living in Pennsylvania. I was working as a substitute teacher, and substitute teachers don't have health insurance, but I needed to have my annual physical. And I went to a clinic and they said, well, you are in luck because we have this new cancer program and it can cover everything you need. So all of these services, I got my Pap test, I got my mammogram, my breast exam. I never would have been able to afford them otherwise, but they were all covered by the program. And here I am 25 years later, having the privilege of overseeing this program, making it available to as many women as possible in West Virginia.
And I know that has to make you feel good. I mean, it's something that you are invested in and that helped you, and now you're looking at how you can help other people. And I think it's great that we have this program and that we have someone leading the program that's really, understands. Because I think sometimes women think, well, I'll just wait, or I'll wait till I get insurance, or I'll wait until I have that available to me and not really seek out these programs. How do we get women to see that if this program is out there, we need you to take advantage of it?
Right. And you don't want to wait till you have symptoms, because if you do, then your diagnosis is later stage if you do have something wrong. We want women to get in and get that good news that everything's normal, that you're in normal ranges with your blood work, so your cholesterol's good, your glucose test came out okay, but your blood pressure is a little high, so we want to watch that. You may have some precancerous conditions that are treatable so that you don't then end up with disease later on down the road that might be life-threatening. So we always just say, pay attention to your body, take charge of your own health, like you said, take care of yourself because you're worth it. Your family depends on you, and you've got, parents probably that you're helping, so you can't just take care of others, you need to take care of yourself as well.
Now, if I'm out there and I'm a woman and, you know, I'm not sure whether or not I'm eligible for this program, how do I get connected, and what happens when I first walk through the door to a provider?
Okay. Well, first of all, you'll be in a very friendly, supportive atmosphere. You may have to fill out a form or two. They'll talk to you about what your income is. Our income guidelines, like I said before, are very generous. 250% of poverty level means that a family of 4 could make $60,000 a year and still be eligible. The woman in that family could still be eligible. So a single woman, 30,000, about 29, 30,000 is eligible for our program. So that's good. We don't want you to think that it's the same as other poverty programs that have lower percentages. We also require that you be between 25 and 64 and that you have no insurance or that you're underinsured. So we'll talk to you about that. Underinsured means that you may have Medicaid, you may have private insurance, but it may not cover everything that you need. So that if you get an abnormal finding on one of your tests, you need something further diagnostically, you might need an ultrasound, you might need a breast biopsy. Those services often aren't covered by insurance, so we can pick that up for you. We can be your supplemental insurance, that safety net that's underneath what you already have.
And it's critical because, you know, once that you have that, if there's an early detection of a problem, if you don't seek treatment, then, you know, obviously it's going to continue to get worse for you. And sometimes money does influence people's, you know, ability to make decisions about, you know, what is my next step, because it's sort of frightening when you think that, you know, that's $500 or $1,000 that I'm going to have to pay out of pocket, and I don't have that.
Well, that would be part of what we're talking about with underinsured. The deductible might be prohibitive, but also you might have a copay, and for some women we know even $20 is going to be what stops her from taking that next step that could get her into early treatment and then prevention of development of disease. So we don't want that to happen. We don't want that to ever be an excuse that I can't afford it, or, you know, I've been referred, I need to get this other procedure done, but I just don't have the money, or I haven't met my deductible. So we want to eliminate that barrier for all women.
It's taking care of women in the state of West Virginia, and that's, again, what your program does. Now, if a person wanted to find out who a provider was in their area, or wanted to get more information about the program, what do they do?
Okay. All of these programs are available on the DHHR website. We're housed under DHHR, so if you just go to that website, which I think that's on the screen. We also have an 800 number that you can call, 800-642-8522. We have nurses on duty all the time that can talk to you. The provider list, we have 180 screening providers in West Virginia. So there is at least one breast and cervical program in every county in the state of West Virginia. There are not as many Wise Women programs, but you can be referred to one that's close to you. So even if where you're going, they don't do Wise Women, you can be referred to a clinic that does do Wise Women and be eligible for all those services, which can include enrolling in a tobacco cessation program. We'll cover the cost of that. A weight loss program, we can pay for that.
All great things. Thank you. Thank you so much for what you do, and I appreciate you being on the show and sharing it. Hopefully they're going to be able to share the specific phone numbers to get in touch with you. Still ahead, how this program goes the extra mile to get you on the path to a healthier you. We'll be right back.